Bismillahirrahmanirrahim. My dear fellows and my students, friends, doctors, consultants, and those who are appearing in any of the local or foreign examinations. I've already said that I am on the path of taking different tutorials on the infection and the diseases in infectiology. It covers, I already said, that 40% of internal medicine, because without it you can't reach up to the target. The thing is this: the bites of the mammal, domestic or the wild. Although the other animals, they do harm to the humans, no doubt about it. So I am actually covering first of all the bites of the mammal, domestic or the wild. Now it is a common experience for the general practitioner that some patient arrived in the clinic and he said that he was bitten by a cat, or a scratch has been produced on the hand, on the feet by a kitten or a cat, or by the dog scratch or a bite, or when he was sleeping in the night, a mouse or a rat had bitten his finger or the toe, etc., because he was sleeping on the floor. And then he arrived to your clinic. Somehow in the rural area, the patient arrived at those person who are moving the horses or the camels. They bite on the neck or the other parts, upper part of the body, because of the person irritated him or her, whatever it is. Because of these things, they are coming in your clinics. It means that in your clinics they do come. For the sake of the simplicity, now these words which I have, sentences and the words which I have used now, I should elaborate also in the Urdu कि भाई देखें, आपके पास जनरल प्रैक्टिशनर्स के पास ख़ास तौर पे इस किस्म के मामला आते हैं कि जी बच्चे को जो है वो इसने काट लिया है, घर में जो है वो खेल रहा था तो बिल्ली को छेड़ रहा था, बिल्ली ने पंजा मार दिया, बिल्ली ने जो है ना वो दांत मार दिया। इसी तरीके से जो है कुत्ता जो है वो या तो आपका पाला हुआ था या कुत्ता जो था वो बाहर का था, उसने जो है वो स्क्रैच कर दिया है या उसे आपको काटा है, यानी इतनी डीपली नहीं काटा है लेकिन उसके दांत लगा है। मतलब इस तरह की चीज़ें जो है ना वो तो ज़ाहिर है वो आती रहती हैं। और सबसे जो अनोखी बात ये है कि वो लोग जो रूरल एरिया में रहते हैं और कुछ सिटीज़ में भी रहते हैं, ज़मीन पे सोते हैं तो वो जो उनको जो है वो चूहों से वास्ता पड़ता है कि चूहों ने जो है ना उनको काट लिया, उंगली पे काट गए या उंगली नाखून पे काट गए या किसी जिस्म के हिस्से पे काट लिया। और जो लोग जो है देहात में रहते हैं तो और दूसरे जानवर भी हैं जिनसे उनका वास्ता होता है, जैसे काव है, बुल है, कैमल है, हॉर्सेस हैं वगैरह वगैरह। तो वहाँ पे भी ये वो पालते हैं, चूँकि पालते हैं वो अपनी हिफाजत के लिए पालते हैं या वो खेती बाड़ी के लिए पालते हैं या सवारी के लिए पालते हैं, तो वो इरीटेट हो जाते हैं बाज़ दफ़ा और वो दांत मार देते हैं। अपने सारबान जो कहलाता है या उनका हिफाजत करने वाला होता है गुस्से में आ जाते हैं, इरीटेट हो जाते हैं। एक और बड़े मज़ेदार बात ये बताऊँ आपको, जो मैमल नहीं है वो, लेकिन मुर्गा जो है वो अक्सर लोग हमारे पास लेके आए हैं कि मुर्गे ने जो है वो चोंच जो है वो सर पे मार दी। गुस्से में आ गया, मुर्गियाँ थीं, वो बच्चा जो था वो मुर्गियों को छेड़ रहा था, इधर उधर भगा रहा था। तो मुर्गा बर्दाश्त नहीं कर सकता ना, वो तो सवाल ही नहीं पैदा होता। वो उड़ के आया, उसने ठक करके सर पे मार दी। वो आपके पास आ गया है। इस किस्म के जो मसाइल हैं, ठीक है, कुछ तो नहर एनविमिनेशन कहते हैं इसको, कि आप जो है ना वो इंटरेक्ट हुए उन एनिमल्स के साथ जो कि एक्चुअली जिनके वो जो जिनके अंदर वेनम होता है और एनविमिनेट करते हैं वो। अब यहाँ मसला नहीं है, मसला अभी जो बात हो रही है वो ये हो रही है कि मैमल्स जो हैं वो अगर जो है ना इन्वॉल्व होते हैं बाइट में या स्क्रैच में, तो फिर क्या करना चाहिए, सवाल ये बताते हैं। इसकी नॉलेज जो है ना सॉलिड आनी चाहिए, जनरल प्रैक्टिशनर को तो आनी चाहिए। अगर उसकी समझ में नहीं आता तो वो रेफ़र करता है, फिर वो जो रेफ़र करता है वो सीएमओ को करता है, सीएमओ को नॉलेज होनी चाहिए फिर, या तो फिर जो कंसल्टेंट जिसको वो बुला रहा है उसको नॉलेज होनी चाहिए ना इन डिजीज़ के बारे में जो डिस्कस की जाएंगी। अगर चाहे वो बोरिंग है, मैं पहले से बता रहा हूँ, ड्राई है, बोरिंग है, ऑफ कोर्स मैं एक्सेप्ट करता हूँ, मतलब माफ़ी तो आपकी नहीं है ना, आपको माफ़ कर दिया जाएगा कि नहीं भाई वो तो नहीं पढ़ा था, क्या हमें नहीं पता था, तो इस तरह से ये मसले हो गए। तो ये जो है ना, ये तो अब ये इसको जो है ना देखने के लिए जो है ना हमने थोड़ा थोड़ा करके जो है ना वो लेके चलेंगे, बीच में आता रहेगा ये जिक्र। अभी जो बात हो रही है ना, एक इंटरेस्टिंग सिचुएशन है, क्योंकि ये हज़ारों साल से मसला चल रहा है, अभी से तो नहीं चल रहा। 1000 of years ago these type of interaction they do occur. Now this is the cat scratch disease, CSD, that is called. And because I want to discuss in detail, but because these type of problems do come in many countries to A and E, and the infections, in fact the clinics who are dealing with infections, or in the rural health centers, or in the urban health centers. That's why I am taking it as a session 1 first, because of the time. I am Professor S. Ali Hazar. You know that I am an honorary global professor of medicine without any name or of fame or economics. This channel is absolutely free. It is not monetized, and all expenses are bearing by me for the to interrupt the poverty of the knowledge of medicine. I want to, I want to upgrade the knowledge, refresh your knowledge, that is, with recent advances if possible. Now this is the picture which is shown that somebody is playing with the cats and a kitten, because the kitten is very, it is immature, and the scratches occurs here, you see, on this area, on the hands, because he was lapping the kitten on the seat, and the kitten scratched on this area because of the love, or whatever you can say. The kitten was playing, and the scratches occur here. Now you see here there is redness very clearly visible here. This is usually a common problem. Now, in cases of the introduction of the cat scratch disease is that it is also called felinosis or bartonellosis because of the organism involved. Felinosis because it is related to the cats. It is an infectious disease. It is infectious disease that most often results from the scratch of the bite of the cat family. Usually cats are here in Karachi, not tigers, not the other family member of the cat. They are not present usually here in Karachi or cities. Rather, they are wild animals, are there in the forest, in the jungles. So we are dealing with those cats who are living in the rural area or in the urban areas. Now this is the hallmark of it. Then in large lymph node, you can see here, this is the scratch which was produced by a cat or a kitten, and it is spread because of the lymphatic drainage to the axillary lymph node. This is the magnified scratch marks. Global incident, that is obscure international incidents, definitely obscure it is, despite cases being reported globally, and seropositive prevalence rates show wide fluctuations between 0.6 to 37% in some areas. 37%. And an association with a warm, humid climate has been established. In those countries which have got the humid climate, warm climate, like Karachi, Hyderabad, Mirpur Khas, etc. As depicted in the study conducted by Nelson et al., spanning the time period between 2005 and 2013, the incidence peaked in 2005 actually. It is 5.7 per 100,000 population. But because of the good hygiene and because of the knowledge you provided, the disease tapered to the 4 now in 2013, and then it is around 3.5. But they do occur. Remember one slogan: a bite or a scratch, 10, if there are out of 10, 1 is possibly will acquire the disease. This is the rule. Whether it is a cat or a kitten or something else, a bite by a mouse or a rat or a cock or a hen or other animals as well. Except the dogs. Separate it, this dogs, because I will take it in a detailed account of the dog bites are concerned. Human bites are also important. Incidents in Pakistan that cat scratch disease has been barely reported in Pakistan. The thing is, because you are not including the differential diagnosis in your mind, that possibly, and the people, they do not come even, on the other hand, with the first documented case being reported in Rawalpindi in 2018 and published in 2020. A new case has now been found in Karachi on 29th May 2022. It was a journal actually of Army Medical College who published this study. Actually, exact number we don't know. I think it is between 3.5 to 10%. In my mind, it is 3.5 to 5% or 6% around. Documented cases. Etiology is that it is gram-negative bacterium. What is called Bartonella hansleyi. Bartonella is a family, genus. Hansleyi is a family, is a fastidious, naturally occurring organism. Then those organisms which are present in your environment, you are living in them, fastidious. Intracellular, it is always intracellular organism. The transmission is that the cat was recognized as a natural reservoir of the disease. That is called philinosis, and it is described by the Robert in 1950. Kittens are more likely to carry the bacteria in their blood, so may be more likely to transmit the disease in adult than in adult cats. Kittens look pretty, you know that. Everybody wants to, keep in the lap, and after, they want all the children, they are attracted to the children specifically, kittens. However, fleas are the vectors for the transmission. Although the cats were a very hygienic animal. So Bartonella hansleyi among cats and viable Bartonella hansleyi are excreted in the feces of the Cetanocephalides felis, then cat flea. Cats should be infected with the Bartonella hansleyi through intra-abdominal inoculation using fleas feces containing the Bartonella hansleyi. You crush it because the flea will bite, and you crush it down, and then the disease can be transmitted. It may be vector-borne, it may be non-vector-borne. As a consequence, like means of the transmission, or the Bartonella handseli from cats to the humans may be an inoculation with a free feces containing the Bartonella handseli through a contaminated cat scratch wound, or by the cat saliva actually. Cat saliva is transmitting in a bite. Ticks can also act as vectors and occasionally transmit the bacteria to the humans. Ticks are also present in the hair of the beautiful animal, but they act as vectors. Combined clinical and a PCR-based research has been shown that the other organisms can transmit Bartonella. A spider can cause the same disease. Cryptic Bartonella means it is latent Bartonella infection may be a much larger problem than previously thought, constituting an unrecognized occupational health hazard of the veterinarians. They don't know exactly why it occurs, because of the flea, because of the ticks, or louse, or whatever it is. They don't know, but the disease is the same. The clinical picture will be the same as cat scratch disease. Now, clinical features: the cat scratch disease commonly present as a tender, swollen lymph nodes, draining nodes at the site of an inoculating bite or a scratch or on the neck, and is usually limited to one side, unilateral. This condition is referred to as a regional lymphadenopathy or reactive lymphadenopathy, and occurs 1 to 3 weeks after inoculation. So, incubation period is about 3 weeks. Lymphadenopathy most commonly occurs in axilla, arms, neck, jaw, but may also occur near the groin or around the ear. A vesicle or an erythematous papule may form at the site of the initial infection, and then it spreads. Most people also develop the systemic symptoms if the Bartonella enter into the circulation. This is the Bartonellemia that is called, such as malaise, the decreased appetite and aches. Other associated complaints are headache, chills, muscular pain, joint pains, arthritis, backache, and abdominal pain are possibilities. It may take 7 to 14 days or as long as 2 months for the symptoms to appear if it is the systemic infection, Bartonellemia that is called. Most cases are benign and self-limiting, but lymphadenopathy may persist several months after other symptoms disappear, but it will take time to resolve. The disease usually resolves spontaneously with or without treatment in 1 month. It may be self-remitting, spontaneous disease. It may be, the patient needs treatment. The symptoms of the cat scratch fever is depicted here. The skin bumps or a rash, or a swollen painful lymph nodes, or muscle aches, myalgia, bone or joint aches, arthralgia, fatigue, fever, loss of appetite, weight loss, or decreased concentration. And the lesion is shown here. Here, this is one with the cat scratch. This is a papule, actually, it is formed after a scratch with a cat. On the lower limbs, again, there are scratch marks. The draining lymph nodes will be definitely here are the inguinal lymphadenopathy. Even these marks, they are these type of rashes are seen on the trunk also, although it is not bitten by the or scratched by the cat. It is Bartonellemia actually. Bartonellemia will cause the rash. It is the entrance of the organism into the blood which causes these type of the rashes on the trunk. You can see here that this is on the neck area, a scratch mark, and then a papule is formed. Now this is the first part of my discussion, that clinical feature has been described, the pathogenesis has been described to you. In the next session we will discuss more about the cat scratch disease, but do remember this is a common problem. You have to face it. Assalamu alaikum wa rahmatullahi wa barakatuh.